Hi ladies and gentlemen, BioPA here with 911 BioCare, and today we're going to talk about a big subject, adrenal fatigue. This is going to be part one in a three-part series. The reason being is because we've got a lot of stuff to cover here. So in this first part, we're going to talk about what adrenal fatigue is and give you somewhat of an introduction to it. Adrenal fatigue is a very real and very common and very significant problem that we suffer in this modern life. What are the adrenal glands? Let's start there. So your adrenal glands are two little glands about the size of probably walnuts that sit on top of your kidneys. And this is an area where they secrete primarily your stress hormones. So we're talking about things like adrenaline and cortisol, but we'll call it cortisone because I think people are more used to that term. So what does that do for the human body? Well, initially this was designed for primarily things like your fight or flight. Okay, so one thing you got to keep in mind is that, in my opinion, the human body is designed really to live about 10,000 years ago, or certainly many thousands of years ago. It is not quite set up to thrive by itself in this modern world, and I'll explain why. 10,000 years ago, if you were walking through the woods and all of a sudden a saber-toothed tiger jumped out at you, it's fight or flight. Boom, the adrenaline goes, boom, cortisone goes with it. Cortisone helps reduce inflammation because adrenaline is very inflammatory. Cortisone also helps with getting blood sugar where it needs to be to fuel that fight or flight. So that happens. You run away from the saber-toothed tiger or defend yourself, and boom, that event's over, and life goes back to pretty calm, right? You're just living in the woods, not too much stress. If that saber-toothed tiger keeps jumping out at you every single day, most likely you're going to move, right? You're going to find somewhere else to live. Now let's fast forward to 2014, where you are bombarded with stress, mentally mostly, but it really doesn't matter. If you believe it to be real, then it's real. So you're bombarded by stress. Your body doesn't know the difference between a confrontation with a tiger and sitting frustrated in traffic on the freeway, or having a fight with your boss or your spouse, or any number of things that happen. So what ends up happening is that we end up in a stressful state, sometimes 24/7. And if we don't have the components and the skills in place to deal with this stress, it will build up. And as it builds up, at some point it becomes overwhelming. Somewhere along that line, it starts to affect our health and our function in subtle ways at first, and then they become more profound as time goes on. So, what is adrenal fatigue? Adrenal fatigue is a situation where when the body and mind are put under constant stress for a long enough period of time, the adrenal glands become burnout, if you will. We're not entirely sure the exact mechanism, but to some extent, basically, they're overworked so much that they begin to poop out. And because they weren't designed to crank this stuff out 24/7, remember, fight or flight shouldn't be happening all the time. What happens when they start to fail? Well, first of all, let's define failure. Your body is an ingenious mechanism. It will continue to produce enough adrenaline, cortisone, whatever, to keep you alive. Okay? It will do that pretty much no matter what. However, that doesn't mean that it's going to do it enough so that you can function optimally. And that's really where we get into the key here. Now, what is it exactly? So I'm gonna grab a resource here. This is called Adrenal Fatigue: 21st Century Stress Syndrome by Dr. James Wilson. I'm gonna refer to this book. I know it may not be the cool thing to do to read out of a book, but I'm going to refer to it because I think this book is really important. And if you suffer from adrenal fatigue or you know someone who does, I think this is a great resource. The reason it's a great resource is because it really gives you a great insight to what adrenal fatigue is, what it isn't, what causes it, and what you need to do on your end to help recover from it. Recovery from adrenal fatigue is definitely at least a three-tiered thing, and I call it like a triangle of recovery. One part of the triangle is going to be balancing hormones and optimizing the hormonal system. The second part is going to be proper diet and exercise. And the third part is going to be, handling stress, meditation, stress management techniques, proper sleep, and things like that. So this covers at least two of those three in here. And so it's a great resource, and it's really written from the patient's perspective. It's not full of medical stuff. It's not something you take to your doctor. This is your homework, if you will, to help recover from adrenal fatigue. So you come into me, I give you that part. Your homework part is in here. So let's look at a couple things in here that I think are important to give you a little background on adrenal fatigue. Okay, so we've already talked about adrenal fatigue being a result of too much stress built up over time. And this goes into it in detail. A lot of times the stress happens slowly over time, and if you're going to hit severe adrenal fatigue, moderate to severe, a lot of times there ends up being another kind of a precipitating event on top of that. So let's say you're under stress, and then boom, you get hit by a car, or boom, you have a big surgery, or you have a divorce, or a loss of a job, big career change, death of a loved one. And that ends up really pushing you over the edge, and then you go into a whole nother level of adrenal fatigue at that point, which it can be hard to recover from. So here's some interesting things about this. With each increment of reduction in adrenal function, every organ and system in your body is more profoundly affected. Changes occur in your carbohydrate, protein, and fat metabolism, fluid and electrolyte balances, heart and cardiovascular system, and even sex drive. Many other alterations take place at the biochemical and cellular levels. Interestingly, even your body shape can transform when your adrenals are fatigued. Your body does its best to compensate for under-functioning adrenal glands, but it does so at a price. Always at a price. Okay. One of the interesting things is that 50 years ago, physicians were actually better at diagnosing and dealing with this syndrome than they are today. And part of the reason is that there was a lot of interviewing of patients, long histories, and people actually diagnosed by listening to the patient. And that's something that I'm bringing back in my practice because I think it is a key component in understanding what's going on with you. We have to spend enough time to sit down with you, talk to you, and hear what's going on so that we can get the full picture, because everybody's different. This is not cookie-cutter medicine, okay? And a big component is to see what the symptoms are. And I can't know the symptoms unless I talk to you and hear your story. And we got to have time to do that, and we got to be willing to do that, and we are. Okay, let's jump down. Adrenal fatigue is a collection of signs and symptoms known as a syndrome. Okay? People with adrenal fatigue often look and act relatively normal because we hide it, you know? They may not have any obvious signs of physical illness, yet they are not well and live with a general sense of unwellness or gray feelings. This is a key component here. They often use coffee, colas, sugar, and other stimulants to get going in the morning and prop themselves up during the day. Unfortunately, these things make the problem worse, and we'll hopefully address that at some point. One of the big things that happens is hypoglycemia. Because of the lack of cortisol, especially later on in the day, your body is unable to properly regulate the blood sugar. Add to that the fact that people suffering from adrenal fatigue often use sugar and sugary snacks to boost themselves up, which makes the problem worse. These high refined sugars skyrocket your blood sugar way past what it's used to, way past anything normal in nature. I mean, you know, what's the sweetest thing you would find in nature thousands of years ago? A piece of fruit. And how often would you get it? Probably not that often. Maybe once a day at best. You know, so, you know, eating candy bars and oh man, soda's the worst, you know. Drinking a Coke, you know, like 12 teaspoons of refined sugar in it is going to wreak havoc in your body. And without cortisone, in order to balance that out, it gets even worse. So it shoots your blood sugar way up, and then you have huge crashes, and your system just can't keep up with it. So you end up being hypoglycemic in a lot of ways. So those people, especially in the later stages of adrenal fatigue, will have problems with blood sugar, meaning that you'll get really cranky when your blood sugar gets low. You may do really poorly when you forget to eat, or if you don't eat at a predetermined time. By the time you realize you're hungry, you may already be too late, kind of like you're already cranky and crashing and in a bad mood and you can't think, you know, because your body's not regulating that blood sugar very well. Also, in the later stages, people suffer from insomnia quite a bit. One of the components of that insomnia can be blood sugar crashes that happen during the night. So because you didn't eat, you know, last time you ate was dinner time or so, then you go to bed, you can't really manage your blood sugar that well, and during the middle of the night your blood sugar crashes. Your body sends out alarms, which usually happen in the form of an adrenaline release. And a lot of times folks with adrenal fatigue will find themselves wide awake. You know, 1 minute you're sleeping, next minute you notice you're wide awake and you can't get back to sleep. A lot of times that is a blood sugar issue. And I recommend to those people, you know, maybe going and having a piece of fruit, or you know, peanut butter and jelly, you know, organic, of course, and then, you know, can enable you to get back to bed sooner rather than later. Sometimes that helps fix the problem. Okay. The adrenals often also have an effect on mental states. This is key. As a result, people with adrenal fatigue show a tendency towards increased fears, anxiety, and depression, have intervals of confusion, increased difficulties in concentrating, and less acute memory recall. They often have less tolerance than they normally would and are more easily frustrated and overwhelmed. I think I would add that. When the adrenals are not secreting proper amounts of hormones, insomnia is also one of the likely outcomes. As their condition worsens, it lays the foundation for other seemingly unrelated conditions such as respiratory infections, allergies, rhinitis, asthma, frequent colds, and a number of other health problems. And this is what I really want to touch on right now, such as fibromyalgia, chronic fatigue syndrome, hypoglycemia, adult onset diabetes, autoimmune disorders, alcoholism, and I'm going to add to this list PTSD, or post-traumatic stress disorder. The worst part of this is that these people may appear to friends and family to be lazy and unmotivated, or have lost their ambition, when in reality quite the opposite is true. In fact, they are forced to drive themselves much harder than people with healthy adrenal function merely to accomplish everyday's normal life tasks. So if any of this sounds familiar or rings true to you, the reason that I'm really tackling this subject is because, the problem is you probably have been told that there's nothing wrong with you, that you just need to, eat better or exercise more. Maybe you've been sent to the psychiatrist and they've given you some Wellbutrin or something like that. But none of those things is enough, and they're not going to help you truly recover if we don't address this component of adrenal fatigue. Take, for example, some of these key ones. Fibromyalgia, okay? Chronic pain all over the body. This, in modern medicine, is a diagnosis of exclusion, meaning that if you go to your doctor with the complaints of fibromyalgia, I'm constantly in pain, my muscles hurt, I don't know why, I'm not really doing anything, I sit around, I feel depressed, I'm fatigued, they're going to work you up for every condition that they're familiar with, and when you come up negative for all of those, and they're done doing that workup, and they can't prove anything serious, they're going to say, well, then you must have fibromyalgia, if they're willing to believe in that diagnosis at all. What I would argue is that fibromyalgia either may be a manifestation of adrenal fatigue, or adrenal fatigue comes hand in hand with it, making it much worse. And here's the reason, or my reasoning behind that. In fibromyalgia, people have a significant amount of inflammation and pain in the body. Your body's way of dealing with the inflammation is to secrete cortisone from the adrenal glands. If you are trying to secrete enough cortisone to reduce your whole body being inflamed on a daily basis, eventually you're going to run out, period. It's just a fact. You are going to run out. So if you didn't have adrenal fatigue before, you soon will, because it's too much to ask from the adrenal glands. They weren't built to do that. And as they crash, and as their output goes down and down, further and further, your fibromyalgia symptoms are going to get worse and worse. So that's a component. Which came first, the chicken or the egg? I don't know. But I do feel that in order to get a full recovery, you have to address both. I have nothing against, and we're not against modern medicine. We're trained in modern medicine. That's where our background came from. 13, 14 years, But what I've learned and realized, as many others are, is that it's not enough sometimes, and we need another specialty. We need to add another specialty, of integrated medicine to address some of the things that aren't being addressed in modern medicine, to complement, not to take over, per se. So what are some other key things? I want to hit these before we get, too verbose in here. Irritable bowel syndrome, once again, there's a big component of inflammation. The body can't keep up with this as time goes on, and your adrenals are going to become fatigued. Depression. Fatigue and depression kind of go hand in hand if the depression is chronic. And I don't really know which came first. But if we don't address that fatigue along with the depression, it's going to be really, really hard, because, just imagine, you're depressed, you're so fatigued, sometimes you can't even imagine getting out of bed in the morning just to go to work or take care of the kids or do life's everyday tasks. They seem overwhelming to you. So we've got to address that component of fatigue. And if we don't, you're not going to be able to have the energy to do what you need to do to get better. Chronic pain. Anybody with chronic pain. And it could come from a very valid and real source. But your body deals with chronic pain and inflammation by producing cortisone. If you're doing that all the time, eventually you're going to burn out your adrenal glands. Plain and simple. And once you burn them out, they're not going to be able to keep up with the issues, and then you're going to have to heal them or recover them. Another disease that is near and dear to my heart is PTSD. And I think especially with all of our veterans coming back, this is becoming much more of an issue. But you don't necessarily have to have gone to war to suffer from PTSD, and it happens here all the time. PTSD, I believe, adrenal fatigue and PTSD go hand in hand. At some point, once you have reached the diagnosis of PTSD, I pretty much think that you have severe adrenal fatigue almost by definition, and that it doesn't much matter which came first. I believe that the treatment for adrenal fatigue is probably at least 80% of the treatment for PTSD. Now obviously PTSD, there's certain components to it depending on the root cause of the trauma that need to be addressed as well to make recovery, to manage that stress healthy and manage that stress well. But we've got to address the adrenals. If we can bring the adrenal function back up, we can help reduce the anxiety, the insomnia, the panic attacks, the poor memory and poor thinking, and just the fatigue itself. Okay, and we'll get into what it's like to be in that state a little bit more in part 2. Okay, I think that's it for part 1 here. This is part 1 out of 3 on adrenal fatigue. Once again, the book Adrenal Fatigue, 21st Century Stress Syndrome by James Wilson is an excellent resource for you. You can get this on Amazon for about $10. And I highly recommend that for anybody who thinks that they might be suffering from this. It is a great resource for you, and it is written from the patient's perspective and for you. And I think it's something that you should get no matter what. It may not be the book that completely speaks to you. There are others out there. You may find a different one that that really you connect with better. But I highly recommend this one as a good starting point. All right. So we'll see you here in coming up in part 2. Have a great day.